Understanding implantation bleeding.
Hello and welcome to our health discussion. Today, we're going to tackle a common question among women, particularly those who are trying to conceive. Is it normal for implantation bleeding to be heavy for 3 days? Let's break it down and give you the information you need.
What is implantation bleeding?
Firstly, let's understand what we mean by implantation bleeding. Implantation bleeding is a form of spotting or light bleeding that some women may experience when the fertilized egg, or embryo, attaches to the lining of the uterus. This typically occurs 10 to 14 days after conception, and it's one of the earliest signs of pregnancy.
How is implantation bleeding characterized?
Implantation bleeding is generally light, often being mistaken for the start of a menstrual period. It's usually pink or brown in color, not the bright or dark red commonly seen in menstrual bleeding. Additionally, it often lasts just a few hours to a couple of days. Some women may also experience mild cramping along with the bleeding.
Can implantation bleeding be heavy?
The key point to note is that implantation bleeding is typically light. If you're experiencing heavy bleeding that lasts for 3 days, this is not generally characteristic of implantation bleeding. Heavy bleeding could be a sign of your menstrual period or possibly a symptom of a medical issue such as a miscarriage, ectopic pregnancy, or other conditions. If you're experiencing heavy bleeding for 3 days or more, especially if you suspect you might be pregnant, it's crucial to seek medical advice. Your healthcare provider can help determine the cause and ensure you receive appropriate care. Remember, every woman's body is different, and experiences can vary. It's always important to listen to your body and seek medical attention when something feels off. Implantation bleeding is typically light and brief, and heavy bleeding for 3 days isn't generally associated with it. Stay in tune with your body, and don't hesitate to reach out to healthcare professionals for guidance. We hope this video has helped clarify your concerns about implantation bleeding. Stay healthy.